You're watching Capitol Connection from the Illinois State Capitol.
Throughout this legislative session, crime was one of the top ticket items for both Republicans and Democrats. In the waning days of session, we found out exactly what Democrats' plans were for combating this rise in crime. Our next guest was one of the driving forces behind that package of legislation. Deputy Majority Leader Jehan Gordon Booth, thank you for joining us today.
Good afternoon. Good to be with you.
Now, Representative, one of the parts of this package that really caught my interest was the Coresponder Model. Why do you feel like this is the direction Illinois needs to head to stem this violence and crime, or the rising crime?
Well, Cole, this Coresponder Model, frankly, was a brainchild of not only law enforcement, but the community. We believe that, when I say we, I mean we as a public safety work group, we believe that there is an opportunity to be able to better work, to build the relationships between law enforcement and community. And really, it requires a 21st century approach to the issue of public safety. And so the idea of doing a corresponder model where we would be putting a mental health or behavioral health specialist inside of a police car, working all three shifts with law enforcement, and then also embedding social workers within police departments to be able to follow up with individuals or victims after they have had, engagement with police officers, so that there is continued follow-up. Because what we know about victimization and folks that have survived tragedies is that oftentimes, if there aren't the proper supports delivered for an individual, your victims can sometimes become your perpetrators, right? Because of trauma and the way that that has an impact on people's lives. And so what we know is that we've done a pretty good job of funding supports and services in community, but we have to do a better job of connecting people with those supports and services. And frankly, expecting police to do all that work, it's unfair to police officers to have to respond to all of these things, because frankly, that's not what they're there to do. And so what we want law enforcement to do what we want law enforcement to do. And we want behavioral health specialists and we want social workers to do, frankly, what they're trained to do. But we can do this all collectively and together. So we're excited about this model and what this could do, not only in the 4 cities that this is being piloted in, but in also the impact that it could have across the state.
Democrats and law enforcement haven't always seen eye to eye on some of the measures that are passed in this building. For those 4 cities, Springfield, Peoria, Waukegan, and East St. Louis, what have those police departments, what has the feedback been for those police departments when it comes to this model?
They frankly have been excited about it. They're excited about engaging in this, again, this modernized way of engaging community. Frankly, police know that, anytime that there is a challenge or danger or folks are struggling, people call 911 and they want a police officer to respond. And oftentimes you're calling 911 because you don't know who else to call. But sometimes when you're making those calls, what you really need is a behavioral health specialist. Sometimes what you really need is a caseworker. Sometimes what you really need is a social worker. And so police feeling like there's someone who can help them to carry the load of engaging in the important work of public safety is something that that law enforcement has been incredibly responsive to. And frankly, this was their idea, right? And so this wasn't something that we're putting on law enforcement. This was something that law enforcement asked for, that we believe is an important element to keeping our communities safe.
What do lawmakers, what does the state need to see over this next year of this pilot program in order to expand this out more to more cities?
I think what we're going to be looking for, we're obviously going to be looking for qualitative as well as quantitative data. So what does that mean? We want to look at statistics, but we also want to look at stories. We know that sometimes the data borne out on paper, it can tell one particular story about what is or isn't happening in community. But what we also know is that law enforcement, as well as those behavioral health specialists, they're going to have the ability to frankly bring the data to life with their stories about what they're seeing and what they are going through day in and day out, specific to what we are seeing in our communities. And so that's what we're going to be looking for. We're going to be looking for the stories, but we're certainly going to be looking for the stats.
There were a lot of criticisms after this session from Republicans about how about the steps that Democrats took, saying they didn't go far enough or they weren't in the right direction. A lot of Republicans wanted to see stricter sentencing, especially now that we've seen a lot of these bills signed into law. What are your opinions on those takes from Republicans?
Listen, public safety is something that's incredibly important to me. I know that, there are a lot of folks who are late to the party on public safety and really like leaning into this issue. As someone who is who is a survivor, not a victim, but a survivor of crime myself, this is something that I know inherently. When I hear stories about, what we did and didn't do, frankly, that's just politics, and I don't engage in it because it's too important that we get this right. Law enforcement was at the table every single step of the way, which is why law enforcement came out in strong support of our package. That's frankly why many, if not most of the Republicans supported all of these packages, because this is good policy. And so, to hear the rhetoric about what it is and it didn't go far enough, frankly, listen, we all have the ability to introduce bills. If there was groundswell support to support the policy measures that they believe that they should support, they should continue working on those policies.
Got it. Leader Jehan Gordon Booth, thank you so much for joining us today. We'll be right back.